So I'd like to begin by acknowledging the traditional owners on whose land you're meeting today and acknowledge elders past and present, and let you know that we're sending this message to you off from Gadigal country in Redfern, our office in Redfern. My name's Damian Griffis. I'm the CEO of the First Peoples Disability Network. I'm a proud descendant of the Warramai people of the Manning Valley, and I have Scottish-Irish heritage also. I thought I'd take the opportunity to tell you a bit about the First Peoples Disability Network. We're a national organisation representing Aboriginal and Torres Strait Islander people with disability and their families. We can trace our history back to an event in 1999 when there was a gathering of Aboriginal people with disability held in Alice Springs. And at that meeting, every jurisdiction, so every state and territory, sent a male and female Aboriginal person with disability to that meeting. There was a number of recommendations made from that gathering, and that included that people go back to their states and set up state-based networks of Aboriginal people with disability and their families. It's very similar to what you're doing today at the Deadly Deaf Mob Conference. What you're doing there is historic, just like that meeting was back in 1999. In New South Wales, we established a network back in 2002, and we, in 2004-2005, undertook a consultative approach of engaging with as many Aboriginal communities as we could across New South Wales. And we visited 30-odd communities and spoke directly with Aboriginal people with disability and their families. And that resulted in the report called Telling It Like It Is, which is still often referred to as the first real proper engagement with Aboriginal people with disability that happened in Australia. And that report identified a number of issues that you'd all be very familiar with for our people with disability, and that included access to education, employment, transport, any number of very serious human rights violations. Meanwhile, the national body during that time wasn't really going anywhere. It wasn't until 2007 when we saw a change of government in Canberra that there was an opportunity to get the national body going again. So between 2007 and 2010, we had a number of national gatherings in Sydney, and from that we built the First Peoples Disability Network. So it turns out the First Peoples Disability Network here in Australia is actually very unique in the world, in that we're the only nationally constituted Indigenous disabled people's organisation that's formally established anywhere in the world. So our friends in New Zealand, the Maori, don't have a national Maori disabled people's organisation as such. They have a strong Maori service provision organisation, and I understand they have a very strong Maori deaf group who are represented at this conference. But they don't have a nationally cross-disability focused organisation like ours. And our Indigenous friends in Canada don't have a national organisation either. So what we're doing here is breaking new ground, like you are at this conference. So we're very proud to be associated with the Deadly Deaf Mob. We encourage each and every one of you here to consider joining our organisation. We want to be strong. We want to speak with proud voices to make sure we have the future for all our people with disability, including the Deadly Deaf Mob. They have their rightful place in Australian society. In 2012, we developed a 10-point plan for the successful implementation of the National Disability Insurance Scheme in our communities. And we're very keen to make that a priority area of our work. Obviously, the National Disability Insurance Scheme is a major social reform and something a lot of our people don't know about and don't know yet how to use to their advantage. So it's very, very important that we spread the word about the scheme to people. But the National Disability Insurance Scheme won't be everything to all people. It's really important also that we support to give a voice to some of the most vulnerable people in our communities and make sure that we are providing them with the advice and information they need to be able to participate in their own communities and the wider community. So again, I'm really keen to ensure that the Deadly Deaf Mob have a voice in our organisation. And I hope that from this conference you'll present some recommendations to us about how we can support the Deadly Deaf Mob going forward and what role the Deadly Deaf Mob want to play in partnership or together with the First Peoples Disability Network. So everyone there, have a really great conference. Can't wait to hear about what's happened over the next few days. Very keen to hear about any recommendations you might have of how we can work together moving forward. But congratulations on what is a really historic moment, something which all of you should be very, very proud of. And one day I'm sure people will look back on the meeting over there at Panthers and recognise this is where it all started. So congratulations, well done.
Oh, hi everyone, I'm Scott Avery. I'm the Policy and Research Director at the First Peoples Disability Network. Really sorry I can't be there at the moment, but it's school holidays and my family have taken me to Europe, so I can't be there in person, but my thoughts are with you and my spirit's there, and I really hope you're having a great conference. Before I start, I'd like to acknowledge the traditional owners of the land on which you're meeting there today, also the traditional owners of where we're filming here today, and the many lands and countries that you've come from. So just a bit of background about myself. I'm an Aboriginal person. My country is Warramai, which is on the coast of New South Wales, but I'm also deaf as well. So my deafness came quite late in my teens. So I actually don't know how to sign, but that's one thing I'm really keen to get back at. So today I just want to talk to you about some of the research that we're doing at First Peoples Disability Network. And it's very a personal thing because a lot of it is around walking in multiple worlds. And so by walking in multiple worlds, we walk in one world as an Aboriginal person and we walk in another world as a non-Aboriginal person. And that also applies to a person with disability. So me, I'm deaf, I walk in the deaf world and I also walk in the non-deaf world. And it's understanding what that actually means. So at the professional level, it's very much about explaining to people who aren't Aboriginal, who are responsible for things like funding and policies, how do those policies impact on Aboriginal and Torres Strait Islander people. But there's another layer to it as well when we're a disability organisation, because as well as being Aboriginal and Torres Strait Islander people, we also have disability and we live with disability. And what does that mean? So in many cases, we spend time speaking to the Aboriginal sector about how do we actually understand disability and it relates to people through the Aboriginal policy. Community is very strong in our culture. So for a government policy to go straight to the individual, it's not very respectful. We talk much about the processes of working through community to get to finding out what the individual need is. So this might apply, for example, in things like education. How does community sit in education? In the health sector, how does the health sector work to provide services for people in that community context? Because it's very different to a non-Aboriginal or a Western setting where a lot of that is focused on the immediate family and the individual. But in the Aboriginal communities, it's that notion of caring is spread much more broadly across a community. So that's coming from an Aboriginal person point of view, but there's also the disability angle. And we know that in Aboriginal communities, they don't see disability in the same way that, say, the Western medical system might see disability. So there's a phrase that I've heard in Dharawal language, is dinbin, and that basically means dead ear. So people might have said to me, oh, you're a bit dinbin in my area where I come from. Of course, that gets confused a bit because it doesn't just mean you've got a hearing impairment, it just means he mightn't catch on to things, and often it gets a bit slow. But other people they might say he's just a bit hard getting around, but this might be someone who's in a wheelchair or someone who's an amputee. That's how they do it. Because what that's saying is that Aboriginal communities make adjustments to people, which is very good, it's very affirming. The downside to Aboriginal and Torres Strait Islander communities seeing disability in a normal way, if you like, or part of the social fabric, is that often that people who do need supports can get left behind and slip through the gaps. So if they do just make those adjustments, often the disability might not get picked up. So for someone who, for example, has a hearing problem, it's just kind of going, oh, he's just a bit slow on catching on. Now, the danger of that is if they go through the education system, for example, and people aren't aware of what the disability and the system doesn't respond, the non-Aboriginal system doesn't respond to their need for inclusive education, then they might go through schooling without having a very basic level of support that they need to adjust to their learning. So what we do know is that disability, there's a lot of undiagnosed disability in communities. But we want to sort of focus on what the need is rather than say, is there a label attached to it? Because Aboriginal people don't have that kind of labelling concept. Is very medical model where we've got to have a diagnosis and that. And now what is there's a lot of emerging disability types that are coming through. So fetal alcohol spectrum disorders or acquired brain injuries. There might not be the medical tool to pick that up. So medical science is lagging, if you like, behind the social need. So if you rely exclusively on a medical model to pick up need, you're going to fall short. And that's particularly prevalent in Aboriginal communities. So what do we do about that? So part of our research program that we're doing at the First Peoples Disability Network is we're kind of suspending judgment about what disability is. So we're going out and we're actually talking with people, and it's called narrative-based research. And narrative is just getting their life story about their experience with disability, and it's told by them on their terms. So we're not making judgments, we're not putting labels, we're just asking people, tell us about your life, tell us about what barriers you've confronted, tell us what works in your life, tell us what matters to you, rather than asking a question, do you have a disability, which could end up to be a very short conversation. So we're using that, and it's very grounded research in that we're getting all these narratives and putting them together. And what we're doing is we're working with our strategic partners, our strategic research partners, to actually analyse that. And that's the basis from which we identify what truly matters to Aboriginal people in terms of disability support. And we're finding some very unusual things happening by this process. And even though we've only just started it, we're finding some really interesting things that are coming out. So there's two streams of narrative, if you like. The first narrative is really capturing that about the community need for disability support. So some of the things, sadly, this is actually rooted very closely in issues of poverty, homelessness, neglect. So it's a very unfortunate story of historical poor policy not being able to respond, and it's accumulated over decades and decades and generations. So we're hearing things, for example, that in many remote communities they don't have the basic public health infrastructure. We're having a conversation with people about what do they want from the NDIS, and some people have said, I'd really like reliable running water, or I'd like to be able to get to the shop to buy milk and bread, but I can't because I've got no footpaths to get to the local shop. Or we would like to have people come and visit us who are health experts and health, but we have no accommodation to put them in. So there's a shortfall in providing basic public health utilities in many remote communities. And this is actually a barrier to, if the National Disability Insurance Scheme comes in and says, well, let's support an individual. How can we support an individual if some of the basic community infrastructure is not in place? So this is what these narratives are picking up. And they're picking up because we're not coming in with this notion of, tell me about you as an individual. We're saying, tell me about your life and how you fit within your community and your environment. How do you connect? So it's a very different question that's being asked, or a very different topic of discussion. So through that, we're going through this process of analysing this. And one stream is actually feeding into things like the National Disability Insurance Scheme. What should they be providing? How does the Australian Bureau of Statistics understand the real prevalence of disability in Aboriginal communities? How does the education system respond from an inclusive education environment? So what should the schools have in place to have inclusive education, not just from a disability perspective, but from an Aboriginal, Torres Strait Islander cultural perspective? What does that mean in terms of the justice system, and what opportunities can seeing things through a disability perspective mean we alter public policy in things like how do we see juvenile detention, the high rates of juvenile detention, many of whom in there have a disability, but it's not being picked and they're not being supported properly. So how can we come up with a different systemic way to dealing with that, rather than just have this path of I don't engage in my school, I end up getting suspended, the bad black kid syndrome, I come into contact with the police, I end up in jail. how can we alter that trajectory through, we provide supported learning education which sits within a community environment. How do we pick up those who've fallen through the gaps and come into our justice system, and instead of sending them to jail, putting them on a supported disability program, how do we get them into jobs where they can actually contribute their skills? So that's one narrative that's come from our research, and that is big. That's a lot of work, and it's just impacting on so many areas of government policy. But we're seeing a second narrative as well. And the second narrative is actually quite affirming, it's quite powerful. So in these processes of collecting these narratives, we're hearing very inspiring stories. And they're inspiring, it's in a very, this is how it works kind of scenario for a person with disability. And I always think people with disability are great problem solvers because that's what they do in their life. So for me, I'm deaf. Where do I sit in a room? How do I communicate? How do I do that? Now, I just make these decisions as a matter of course. Someone who might be in a wheelchair, how do I get around? How do I get to work? These are all decisions that they have to make. And they just get on with life and do it. So they're very good, innate problem solvers. So there's all this kind of quite empowering skill that we see as we go along. So I've met a triple amputee who I say could bend a system with one arm, because she can, through having a lived experience of disability, has accumulated this wisdom about how to do things better. So this person talks around some of the things that she's had in the health system. And she's able to say, well, look, I never used to speak about being an Aboriginal person because I didn't want to have that barrier. And the story that she tells is that she's confronted barriers along the way. And it's more than just access barriers. I can't get into the hospital. It's the attitudes of the health providers. And it's this subconscious bias that people have held. Often they may not be aware of it. What they do is they would see the disability or the person with the disability, but they wouldn't see what the real health need is. So through that experience and her telling that experience through a narrative, we can understand some of these attitudes that are barriers in the health system, and we can see what access to health means in a different sense. It's more than just having a doctor or a nurse or a clinician on hand. It's actually that they are equipped with the skills to say, this is what your real health need is. And they're not subjected to their own subconscious biases that they might not be aware of in providing healthcare to people. So there's a form of wisdom. And there's another gentleman I met, an Aboriginal man who lost his sight, and Steve, his name is, and he provided us with the narrative. And in that narrative, when I met Steve perhaps 5-6 years ago now, and when I met him, he was saying that there were lots of people who were dying in his community, and he said that I'm going to too many funerals. And he said, when his narrative he speaks of, he goes, I needed to do this. I had my own personal issues of losing my sight, and I had to come through that. But when I come out the other side, and there's a line he says, losing my sight gave me a new vision. So here's this man who lost his sight, and he's got a new vision, and his vision is to be a leader in his community, to challenge what is really disabling in his communities, which is this broken spirit. So these narratives on one side are very informative on how we can make things better, improve the lives of Aboriginal people. But there's this empowerment side. So through these narratives, we are actually understanding what power really means. When we talk about empowerment, this is a power because they speak from a position of strength. They speak from a position of wisdom where Aboriginal and Torres Strait Islander people who have that lived experience are using that knowledge, whether it's being discriminated against or having to get round or having to adjust to life. That in itself is quite an affirming and quite a learning experience that we're going through. So that's what our research is uncovering. It's really going to be directed by the community. So these are voices of Aboriginal and Torres Strait Islander people with lived experience. It is their terms, it's their agenda. So how we work now is we start with these narratives that identifies the needs, and we use a phrase that we picked up when we've been overseas, and it's called professionals on tap, not on top. So the Aboriginal and Torres Strait Islander people are defining the agenda, and then what we will do is bring in the experts that can help us achieve that need. So we're working now with strategic partners, and our founding partner is the University of New South Wales, the School of Public Health. And so what we are doing is we are talking with the community, and they are helping us provide that research rigour, that methodological rigour, to enable us to publish this. Then we can publish this work, and by publishing that work, we can get it out in the public domain. We have greater capacity to influence how governments implement their policy. And that's working quite well, but it is a very different thinking. And the phrase professionals on tap, not on top, says the community drives this all the way. So it's very different to how research has been done in the past, where there's a body of knowledge and we might get funded to do this little bit extra. And typically a research institution might contact us at First Peoples Disability Network and say, would you like to be part of our research project that we've devised? We're changing that. It's First Peoples with Disability who are devising the agenda, and we will bring our research partners in under that. And through this triangle of support where we have community on top, we work with our strategic research partners, we can then have this discussion with the policymakers in the NDIS, in the Australian Bureau of Statistics and other areas of government. So it's very much a different way. And this conference we see is very much a breakthrough, and we think many people in this room we would very much like to speak to down the track and give you the opportunity to provide your narratives. But I think the Deadly Deaf Mob will provide a very unique insight into this and build on things that seriously has not been done in the world, let alone in Australia. This is actually breaking through. We've had interest from overseas. We're working with some of the top international disability researchers supporting this. So these are people like Professor Tom Shakespeare, East Anglia University, the Network of Disability Research in the Nordic countries. We've presented this research there, and Indigenous populations around the world are going, this is what we experience too. So this is actually quite exciting times and quite an exciting research project that we're just starting at the moment. We're just starting to collect the narratives, but even though what we're finding in the very, very early sense, the breadth of opportunity to take this concept of community-driven research and change the way it can affect how services are delivered on our terms. That's where I think that's where when we're talking about power, and that's what we're talking about empowerment. So thanks again for letting me talk today. I hope you have a fantastic conference and many great things come from it. So I'm looking forward to hearing about what does come from this conference and an opportunity to meet many people in the room that I haven't met and be part of our research down the track. So thank you again, have a great day, and look forward to my postcard from Paris.